Every day I went in the hospital, I was trying to do the best job I could. Surgery is interesting because what you really have to do is you have to balance a lot of things. You know, you have to have empathy for your patient, and you have to understand what's going on with them and diagnose what's going on with them. But then on the other hand, you have to take a knife and cut into them and try and fix it. I'm a firm believer in I treat, God heals.
Dr. Raynor has done 14 surgeries with me. I was born with a birth defect called congenital diaphragmatic hernia. My diaphragm didn't form, and basically at 3 days old, everything was puzzle pieced back together by Dr. Raynor. When I was itty-bitty infant, any doctor, nurse, pediatrician could pick me up and I was the happiest little baby. Dr. Raynor would pick me up and I would be mouth open screaming. He's family. He's just always been in my life.
I actually had a lot of difficulty in trying to decide what I wanted to go into. But what I found out in my rotations is that the surgeons seemed to be the person who had the ability to have the greatest impact on their patients on a relatively defined period of time. When I would always go in with a suit, coat, and tie on. And because I remember one of my instructors when I was in general surgery would always do that. And, you know, I asked him why one time. He said, well, the first time they meet you, you're probably telling them something that they don't want to hear, so you should look the part. And I took that to heart.
He was a surgeon here for 34 years. During that time, I bet he did 20,000 operations. And then you add in the people that he trained as surgical residents. And then you look at the med students, not to mention the patients he cared for. And I'm just not sure that there's been someone who's had such a big impact on pediatric care in Nebraska as Dr. Raynor.
I was about as green as you could be when I started working with Dr. Raynor, and he patiently taught me everything that I know about pediatric surgery, and I still hear his voice when I take care of patients. What would Dr. Raynor do?
He wants to make sure that everyone who's caring for them sees them as the cherished gift that their family sees them as, and not just a case or a room number or a procedure.
He was a strong leader, and that has benefited the community, and it's benefited the children of the community and the region. I think one of the kind of pinnacle things for Steve was his work with the College of Medicine in bringing to Omaha a pediatric surgery fellowship. Steve was always interested in the quality of care and the availability of care for the patients that were to be served by Children's and by the surgical team. And so Steve is to be commended for that leadership in the community.
It is the legacy of knowing that he's molded how our future generations approach patient care and surgeries, and that we look at patients with compassion, that we take into account the impact of what we might think is a simple intervention and are compassionate to that whole family.
I was fortunate to be at Children's at a time where there were a lot of really, really talented people who trained at really great places who wanted to come back and live in Omaha. I felt privileged to be able to do it.
I always know good things are gonna happen when we see him. I go every day in life remembering what he's done for me and what I can do for other people, and he's taught me, like, even on the worst days, you get up and walk and you take a step forward. I don't think there are words to say thank you to him, because I'm here because of him.
It's hard to be a pediatric surgeon. It's a lot of work, and there's a lot of time away, and I couldn't have done it without the support of my wife and children, and in my extended family as well. I'm very thankful to get this award, and very grateful for the recognition. You know, it comes from my peers, and certainly a lot of the people that have been recognized before, and I'm humbled and very grateful to be included on that list.